Well, good morning, everybody. We are here at St. Elizabeth's, but I guess you all figured that out, right? We're here at St. Elizabeth's this morning to make a major announcement that we think will have an enormous positive impact on the health as well as the well-being of the district's residents, to the economy of Ward 8, and to the finances of our city. We know how imperative it is for us to have a full-service hospital on the east end of our city. It is something that I've said repeatedly as we've worked hard with the United Medical Center. Just by way of history, in 2010, the city took control of the United Medical Center. However, I think it's known to virtually everyone that it's been difficult for the district to own and operate United Medical Center in a way that is fiscally responsible. I don't think it's an exaggeration to say that this hospital has proved to be something of a money pit since it was taken over by the District of Columbia. After all, over the last decade, the taxpayers of our city have subsidized UMC to the tune of at least $160 million. And even with all that subsidy, the current facility still requires significant improvements in order to continue attracting not only the medical professionals that we need to provide quality care services to the residents of Ward 7 and 8, the 140,000 people who live on the east end of the District of Columbia, but also to attract and retain a good operating partner. We aren't the only city in this boat, but we are one of the few that is in the financial situation to be able to actually do something constructive about it. Cities and counties across the country are currently attempting to divest themselves of non-university-based public hospitals and freestanding community hospitals. Many hospitals are closing because of their supporting municipalities' inability, or county for that matter, to continue to cover the ongoing operating losses and the capital investments. And in a few years' time, on our current trajectory, the district would be forced to simply close United Medical Center as doctors and patients flee this outdated facility, which is now over 50 years, substantially over 50 years old, probably 60 years plus old. I might add, too, that each year that I've gone to meet with the rating agencies in New York, along with Chairman Mendelson and Councilmember Evans, we have been asked by one rating agency in particular what the future is of the current United Medical Center. They've not been happy that we've been operating the facility ourselves, even though the last time they were there, they were happy with the fact that we are making progress with this facility. But them and us, the long-range vision is different than what it is now, at least what the operation is now. So unless we have the courage and the vision to act decisively now to solve the problem once and for all, the hospital will fail. And the district will have spent all these hundreds of millions of dollars without really anything to show for our efforts. Healthcare reform is good for the nation and good for the residents of the District of Columbia. Just so it's clear, we now have 96% of our children, a little over 96% of our children who are covered with health care insurance, and we've got 93% plus of our adults who have health care insurance at this stage, and that number is increasing every day with the success of our exchange. Again, it's a complicated and complicating business, the business models that are associated with health care delivery, even for state hospitals. Freestanding private hospitals will find it very challenging, if not impossible, to function in a post-Affordable Care Act world. The delivery system is consolidating and integrating to achieve more seamless care and greater economic efficiencies in response to reimbursement changes. We see the evidence of this consolidation throughout the metropolitan Washington area, where there are many, there are actually not very many freestanding, unaffiliated hospitals left. So where does this leave the District of Columbia and United Medical Center? For starters, we know that no operator will take UMC as is without a significant subsidy to entice them. We know this because we've asked. While operating losses will significantly decline this year as a result of the transformation effort, we know these improvements are merely a Band-Aid, and they will not continue to move forward or continue, period, without major investment and growth in new services, more physicians, easier access, state-of-the-art equipment and facilities, in other words, to be able to be competitive in the current emerging, rapidly growing healthcare world. These investments need to be made soon before the hospital again deteriorates to the point of no return. No operator will make these investments because while the hospital may continue to grow, the profit potential will not provide them with the sufficient return that they need on their investment to justify the significant resources that they will have invested in this effort. Therefore, the district will be on the hook for these investments. We also know that if we do not address the urgent capital needs of the hospital soon, United Medical Center is guaranteed to begin, and not to be hyperdramatic, but begin a death spiral from which recovery will be virtually impossible. The hospital will close as a result of that. The district will have wasted again at least $160 million with nothing to show for it, and there will be no hospital on the district's east end, which is completely unacceptable to me. As part of the hospital's recent strategic process, it is projected that over the next 5 years, UMC could lose up to an additional $100 million if no investments for growth are made. This is separate and apart from additional annual capital investments in the amount of somewhere between $6 and $8 million a year. Unless we take decisive action to change the current trajectory, a game changer, if you will, then the district will be required to cover another $100 million in operating losses as a result. The residents of Wards 7 and 8 will still have the region's worst health outcomes due to lack of doctors, accessible programs, and appropriate facilities. And the hospital will begin to fail as doctors leave the facility, again, as I mentioned earlier, eventually closing as a result of that altogether. I don't think it's any exaggeration to say that a healthcare crisis exists on the east end of our city, and that $100 million in investment just to maintain the status quo would do little to help. One need only look at some of the healthcare outcomes that we have on this end of the city. You look at heart disease, you look at cancer, you look at asthma, you look at HIV/AIDS, you look at virtually any health issue, and you will find, unfortunately, the outcomes to be the highest on the negative end in the District of Columbia, the further east you go in the city. So the choice is not whether we continue to make capital investments in the hospital, but how best to make those investments. I've come to the conclusion that building an entirely new hospital on the St. Elizabeth's campus makes the most sense for the district in the long run. Investing in capital improvements at the existing UMC facility just doesn't make sense for several reasons. One, for starters, even after making a minimum of a $100 million capital investment, the district would still be forced to cover $6 to $8 million every year in facilities maintenance, twice what a new facility would cost in maintenance. Secondly, at the end of the day, after all, it would still be a 60-plus-year-old facility. Thirdly, investing in the current site does not offer us a meaningful rebranding opportunity for the hospital. Fourthly, the current site is really not metro accessible. Even though there's a metro a few blocks away, it's still really not accessible as one would like a hospital to be. And by the way, I think you know the Congress Heights metro facility is on these grounds. And then fifth and finally, all these investments would not meaningfully increase the chances of the hospital attracting a high-quality operating partner for the hospital. Building an entirely new United Medical Center here on the campus of St. Elizabeth's, while more costly in the short run, provides the most long-term advantages and definitely, we think, solves the problem once and for all. One, it allows us to begin implementing our reform plan more quickly than in continuing to invest in the current site. We would have a brand new startup, a state-of-the-art facility as a startup in a new area of the East End right here in Ward 8, affording us a major rebranding opportunity and the potential for significantly increased market share that simply does not happen and will not happen without these investments. We would slash the ongoing cost for facility maintenance and improvement by about half. The site would offer much better access to public transportation from across Wards 7 and 8, as well as other parts of the area. We would greatly strengthen our likelihood of attracting a high-quality operating partner for the hospital, and this would further stimulate economic development here on the St. Elizabeth's campus, serving as yet another focus to attract subsidiary offices, services, and retail options to service the thousands of employees and visitors to and for the new hospital. I think most of you know we have 180-plus acres on this side of the campus, which is a huge tract of land. And, of course, we obviously have a very new and modern psychiatric hospital that is already located here that would operate in concert with an acute care facility. Again, while this is a major undertaking, we'll do it responsibly. In fact, we've already been engaged in the due diligence on this for more than a year. And it's why I included a feasibility study in the budget this year, and working with Huron, that's one of the questions that's been before them, and that is what makes sense in terms of starting with the premise that we need and will have a hospital on this end of the city, what makes sense in terms of the capital investments that are involved. We would seek to identify an operating partner before breaking ground on a new hospital, which we think will be markedly facilitated as a result of the commitment to build a new hospital. And we think having a new hospital will result in our best chance to be able to attract a strong partner to be able to operate the hospital. This is perhaps the single most convincing advantage of building a new hospital over investing in the current one, and that is having a partner who really can operate these services in a way that we would like and would get the district out of the business of operating a hospital, which was done out of necessity rather than desire. We would be fully prepared to make an investment of up to $300 million over several fiscal years and leverage it as a part of the partnership negotiations. But we will not break ground until the new operator is nailed down. My friends, I think this is simply the right thing to do, and that is to be able to ensure that no matter where you live in the District of Columbia, geography does not determine your likelihood of being able to live a healthy and successful life. And we believe that puts us in a position to do that. I don't think there's any question, but it's a major undertaking and a major responsibility. But I think, personally, it would be foolish of us to put it off or shirk it for right now, or pretend that even though we're making progress, that there aren't more fundamental structural problems that exist with this business relationship for this hospital. I'm committed to doing it right, and also trying to do what's right for all the people who live in the District of Columbia. And that means building a new hospital here and leasing it to a private operator to be able to upgrade health care. And by the way, I should say this too, that it isn't just building a hospital. I think we recognize, of course, that a hospital is only a part of a health care system. that to the extent to which you have a strong primary care system and a strong ambulatory care system is the extent to which a hospital will be used for the right purposes, rather than having people who use the hospital as a default setting, who go to the emergency room, no matter what their condition may be. We've decried the fact that people have done that over the years, but I don't know why it would be hard to understand it, because there wasn't anything else for the most part. There has been no primary care system. There's been no clinic system to speak of. We have, by the way, in the last couple of years, not even full 2 years, we've opened 3 new clinics on the East End. The Anacostia Clinic, which opened in May of 2012, which is operating extremely well. It doubled the number of patient visits in terms of its capacity to be able to serve people. We just opened the new clinic in November in Parkside to replace the antiquated Hunt Place clinic. And we just opened a clinic in Bellevue just a matter of a couple of weeks ago. And that clinic doesn't replace anything, because there was nothing in that area of the city. So one of the things that we want to make sure people do is to contextualize what a hospital means, a new hospital means, and that is putting it in juxtaposition with other healthcare facilities so that there is a relationship. We would expect there to be strong relationships between the clinic system, the ambulatory care system, the primary care system, whatever one wants to call it, and the hospital as a referral source. I've looked at the data that Huron has generated, and I think just from a geographical perspective, something like 85% of the people who live in close proximity to the hospital don't choose to use our current hospital. They go elsewhere, and that is simply intolerable for the folks who are choosing to do that, and probably choosing to do that because they feel that we don't have the quality of product on this end that they would choose to use. There was this is 2-3 years, actually longer than that, 3-4 years ago, when there was an accident on Southern Avenue in close proximity to UMC. It was a mom and a child who were hit by a car, and neither one of them was taken to UMC, even though UMC was the closest medical facility. And that speaks volumes, ladies and gentlemen, of how people perceive the quality of the United Medical Center, and we intend to improve that. Again, we don't have the luxury, we think, of continuing to postpone the difficult decisions that are associated with this. We've got a couple of speakers that I want to have you hear from. First of all, the chairman of our board of the Medical Center, Bishop C. Matthew Hudson, who's the senior pastor of Matthews Memorial Baptist Church, and as I indicated, chairman of the UMC board, and then David Small, who is the interim CEO of the UMC. And then after they both speak, we'll be happy to take questions that you have about this. So, Bishop Hudson.
Good morning. Amen. Today is a great day for the residents of the east end of the District of Columbia and surrounding neighborhoods, but more importantly, the residents of Ward 8. First and foremost, as a proud tax-paying Ward 8 resident, and on behalf of our board of directors, who we do have some board members, if you would stand, please, just to acknowledge your presence, our board members that are present. Also, on behalf of our staff, the United Medical Center, who we have medical staff that is present, executive staff that are here, if you would stand, just to acknowledge your presence here today. Wave your hand if you're standing. Amen. I simply want to say thank you, Mr. Mayor. Thank you to the mayor, the members of your leadership team for your visionary, steadfast leadership over these 3.5 years that we have been at this. since the mayor has been in office, for your willingness to make health care and the access to quality health care a priority. I have heard the mayor repeatedly say that he is committed to making sure that a hospital remains on the east end of the District of Columbia, and today his actions speak louder than his words as he fully substantiates what he has been saying for quite some time. Today's announcement shows that the mayor is a man of integrity and impeccable character, as he demonstrates that he is a man of his word. We thank him for standing firm behind UMC, both financially and with a sincere heart. Our community is growing and expanding, and with that comes an array of pressing needs, which no doubt includes quality health care. This administration, the board of directors, the staff of the United Medical Center, and Huron Consulting have all worked together to transform our hospital into a first-class medical facility, from operational improvements to high-quality patient care. We have already added 19 new physicians over the past 12 months. We have started recruiting specialists and primary care physicians with a focus on cardiology, oncology, general surgery, and orthopedics. And the hospital continues to add and enhance its diagnostic technology. The employees of United Medical Center have worked through some very challenging times, but over these past 3 years, we have seen substantial improvements in the operation of our facility, and it is because of our dedication, experience, and experienced employees. We are creating a culture of excellence in healthcare services. I take this opportunity to thank our community for sticking with us through the tough times and allowing UMC to be your first choice for medical care. And we want to welcome back home those who have sought services elsewhere. Mr. Mayor, I can't say if I had 1,000 tongues to say thank you, I would use 1,000 tongues. But since I don't, I just want to say thank you, thank you, thank you. You have our commitment from the board of directors, from the community, from the hospital executive staff and managers, and to the 1,000+ staff, that we are standing with you as we strive to provide the best medical care possible to this community and beyond. Today is the first sign that this community will no longer need to travel miles away. Instead, we can get exceptional care by exceptional people right here in our own backyard. Thank you, Mr. Mayor. Thank you.
Thank you for those words, Bishop, and thank you, Mr. Mayor. This has been not a quickly cobbled together process. As the mayor mentioned, and as the bishops talked about, this has been a long process of looking at the data, coming together and understanding what that data is saying, and forming a very comprehensive, very thoughtful plan moving forward. Last spring and summer, as part of the informative process to develop a new strategic vision, we engaged in interviews and discussions with hundreds of folks, stakeholders of UMC, stakeholders throughout the district, other providers, our own providers of care, our staff, and most importantly, the residents of our local communities. There were several themes that continue to come out through all of those discussions. One, we want and need conveniently located healthcare services. We want them delivered in a full-service hospital environment. And three, we must have, simply must have, more quality healthcare services and physicians locally available. To paraphrase a recent and fairly successful sports movie, if that level of high quality and state-of-the-art facilities and physicians is available, then we will come. A second area of comment received during these early stages of seeking out a suitable and appropriate operating partner for the future success of UMC that is demanded under this new era of healthcare reform. We heard repeatedly and continue to hear the very first question: what is the level of actual commitment that the district is willing to make? The third instance of comment I receive on a daily basis. As the interim CEO, I am busily with my staff trying to recruit additional frontline staff, managers, and physicians to join the hundreds of dedicated men and women who do service now for our patients. In all of those cases, the questions and comments I get: will I have a job? Will the resources and facilities be there? And in particular for doctors, if I'm going to locate my practice there, will you support us? If I'm going to join and make a commitment, where's the commitment on the part of the organization and its ownership, the district? With the strategic vision and plan that the board adopted last August, it was clearly stated, yes, time is not the friend of UMC in this endeavor. Decisive, timely action in terms of district commitment and finding an operating partner is needed to ensure a vibrant, viable, and value-adding local healthcare community service delivery system. And as the mayor talked about, this building, a hospital, is only part of that system, and it's only part of our plan. It takes an integrated village, if you will, and this is a major part of it. This is the type of decisive action that will signal to residents, potential staff and physicians, and to healthcare system partners who we are talking with and who are talking with us, that the necessary real commitment in support of words on the paper is actually there. Thank you, Mr. Mayor, and thank you very much.
All right, we'd be happy to take any questions. And by the way, Councilman Barry wanted to be here, and he's unable to be here because of a prior commitment. But he wanted me to convey his sentiments that he is ecstatic about this hospital potentially being rebuilt. I won't say potentially will be rebuilt on the east end of the city in Ward 8. Maybe he'll get it before it's over with, but I wanted to make sure I said that on his behalf. Ms. Brazil.
I have two questions. In your press release as well as in your remarks, you made reference to a feasibility study, and in the press release it said a feasibility study for the project was included in your FY 2014 budget. Is that feasibility study complete, and will you make it available?
Let me ask Huron to speak to that, because they've been leading those efforts.
Thank you. That feasibility study is not complete. We started with the community assessment needs plan that informed within the 100 days that we were asked to do that with the board to develop the strategic plan that helped inform then the next set of steps. We have spent a number of months working with the mayor's administration, the city administrator, et cetera, looking at potential sites, looking at best ways to deliver on the strategic plan. From that point, we'll then inform and continue to spend money on developing the necessary design and activities associated with that.
So isn't this announcement rather premature then, in terms of if you haven't completed the feasibility study, how do you know about the viability of the project?
I know it's viable. I know it is. Just walk out on the street and talk to anybody out there, Ms. Brazil. And I live over here. I'm over here all the time. I know it's viable. And, you know, when we finish this feasibility study, it's going to come to the same conclusion that we've already come to, and that is that we need a new hospital. It doesn't make sense to throw good money, I won't say after bad, but this isn't the most feasible way to spend district taxpayers' dollars. We're not going to close this hospital, period, because that would leave the people on the east end of the District of Columbia with nothing. That is not going to happen. And in order to get to the next level, we got our 15 budget that's coming up that will be transmitted to the council next week. And frankly, I don't have any reservations. You know, people want to say I'm out in front of it, fine, I'm out in front of it. That's what leadership is called. So we're taking leadership on this. Will.
Following up on Dorothy's point, though, I mean, what's the point of doing the feasibility study if you're going to make this announcement beforehand?
Well, because it's more than just looking at the building. It's also looking at how we continue to move forward with an integrated healthcare system over here. One of the things that we've talked with Huron about is, in addition to the 3 clinics that we have already opened, there's a possibility of 2 other clinics opening. What is the approach then to integrating the other medical and healthcare services over here? What is the issue? What are the issues around finding an operating partner? How do we structure that process? So again, I'm not going to let this budget opportunity go by without making a statement to the people on the east end of the District of Columbia and without making a commitment to the investment. We'll work with the council during the 56 days that they have to work on the budget in order to be able to get to the finish line. But that would be absolutely a dereliction of responsibility to me to say, well, the feasibility wasn't studied and wasn't finished, so I'm sorry, but the opportunity to do something with the 15 budget is gone, and I'm not going to do that. Who's saying this up? Media. Oh, Mike, I'm sorry.
Once the hospital is built, we spent $300 to build this hospital.
$300 million.
What do we anticipate the city's ongoing commitment to the hospital would be? I mean, would we be on the hook for maintaining and improving the physical plant, or how would this be structured in terms of the city's ongoing commitment?
Let me ask Huron again to speak to that. But we would own the building, Mike. But obviously, with a brand new facility, the maintenance cost for that building would be for years more of a routine nature than what we have now. And that is a building that is so antiquated. It has some extraordinary costs associated with it. You know, and then being able to work with a partner who probably would not be attracted to the facility that we have now because of the extraordinary costs associated with it. And don't forget that one of the things that we do is operate the public insurance company, which is the Medicaid program. And the Medicaid program would be available as it is now and probably would be even more extensively used with the Affordable Care Act being effective at this stage. The Medicaid program having been broadened, even though we have one of the broadest coverages now for a Medicaid program in the nation, we'll be covering more people. A lot of those people will live on the east end of the city. So probably our most substantial commitment will be in terms of making sure we continue to operate a viable Medicaid program that as an insurance option will be available to the people who will use the hospital. Ms. Brazil.
Can you just talk about the process of recruiting a partner, and how will that happen before we break ground on this hospital? We know who will be running it beforehand.
Yeah, that's the idea, to be able to have a partner identified. I don't know how difficult that will be because this is new territory for us as well. But I absolutely think it will be infinitely less difficult with the prospect of a new facility to be able to operate. It is a game changer. That's right. Yeah, it's a game changer. It'll be infinitely less difficult than trying to get a partner to be able to work with us at the current facility. And I've actually been involved in some of those discussions, and I can tell you those with whom we've talked have balked at doing it just because of the nature of the facility itself, the current facility.
In terms of how these agreements are structured, maybe Mr. Spall knows, I mean, is there any change of hand? Do you pay the partner? Does the partner pay you? Is it, I mean, how is I'm trying to get some clarity on what the city is. The city going to be spending additional money once the hospital is built?
Michael, I don't want to beg the question. I certainly don't want to get us involved in public negotiation with potential partners. That would be premature. But I would tell you that the objective would be to find an operating partner who would be at full risk for the operations and ongoing maintenance in support of the strategic vision and plan and service to the residents. So essentially, with the district putting up the initial capital investment to create the facilities, and then an operator coming in under some appropriate structured business arrangement to run and operate at full risk in service to our mission.
I think this is similar to what Prince George's County is doing as well. I haven't had extensive discussions with them about their plans and their approach, but they are committed to building a new hospital for the county. And I'm absolutely, well, I don't say I don't think that they have any intention of running it themselves. So the business model is very similar to what others are doing at this stage as well. Ms. Brazil.
Over the years, with the closure of DC General, various options have been pursued, including looking at existing hospitals in the District of Columbia, whether or not it was Howard University or George Washington, Georgetown, or Metro, as well as looking outside the district to Johns Hopkins, to operating a hospital east of the river. And all those negotiations and discussions fell through, and especially with Howard in a very nasty way. The question that is going to be asked, I think, by most DC residents, why is the district building a hospital and not looking to an existing hospital or hospital outside the district to build a hospital and operate?
Well, first of all, there is no hospital that I know of that would build a hospital here. When I first came onto the council, there were discussions with Howard University as a potential partner with the city to build a new, I think would have been a $425 million facility where DC General is now. And the financial negotiations, if you will, broke down because I think ultimately Howard didn't have the financial capacity to be able to do it because they've had their own challenges. So I don't think it's for lack of interest, and this is one of those where the strength of the commitment is going to be measured by the willingness of the district to put the basic pieces together to really create a first-class healthcare system here. There have been various and sundry discussions over the years, but I don't think any like this. This is really talking about something bigger than a hospital. This is talking about an integrated healthcare system that we are committed to trying to develop. You know, when you look on the east end of the District of Columbia, you have now, today, 140,000, almost 150,000 people who live on this end of the city. That's a small city. And frankly, to have people in a precarious situation where they have to go to the other part of the city puts people in, you know, I think a precarious health care position. And frankly, to me, it sends the wrong message. It's the message that's been sent to people over on this end of the city for years, and that is, you want something good, go elsewhere. Yes.
Can we change the subject at this point, or not yet?
Could you speak to the timeline and the intended
By the way, I have
capacity?
another subject after this, so.
Could you speak to the timeline and the intended capacity of the facility?
Well, first of all, the timeline is we will present this in the capital budget that will be transmitted next week to the council. In terms of the other question, I guess the selection of a partner and that sort of thing, is that what you're talking about? as soon as we can. I think having now on the table a commitment to build a new facility will markedly elevate the interest on the part of others in doing this. So, yeah, it does. It changed the conversation. It is a conversation changer. Other questions on the United Medical Center? Aren't you all really excited about this? I mean, thank you, Bishop. Thank you, Mr. Small. Okay. I have another announcement I want to make. You're probably wondering what all this stuff is up here for. It's pretty healthy looking, isn't it? Including those fish down there. This is actually an announcement because it concerns something that will happen right here at the St. Elizabeth's Gateway Pavilion, which is also known, of course, as Gateway DC. I want to ask Scott Alshouse, who's president of the Whole Foods Market Mid-Atlantic region, to come up and join me at this point. Gateway DC will kick off its Gateway to Health program with a Whole Foods pop-up market at Gateway DC starting April 5. They will be here from noon until 5 p.m. The market will be open the first Saturday of every month during the spring and summer months. Whole Foods will offer produce, meat, fish, and soup at reasonable prices, ladies and gentlemen. Through the pop-up market, Whole Foods intends to engage the Ward 8 community in order to determine what would best serve the customers in this part of the District of Columbia. Whole Foods is committed to expanding its reach in the District of Columbia and is exploring several locations, especially in what we term as food deserts here in the District of Columbia. They're interested in bringing quality food to areas with limited access. I don't know whether you all know or not, but Whole Foods is going to be building two new stores, one of which will be at 600 8th Street Northeast, which actually is 2 blocks from where I grew up, and is scheduled to open in late 2016. The second location will be at Buzzard Point, and I suppose there may be others at some point in the future. In addition, upcoming Gateway to Health programming will be hosted right here, and it will include the Broccoli City Earth Day 2014 Festival, which we started that effort last year, and that will be on April 19th. It was really fun last year what we were able to do with that. This raises awareness about environmental wellness programs and strategies available to residents. You know, some of you may recall that we announced a program a number of months ago that said those who wanted to come here to the campus for a period of 6 months, that they would have to pay $1 a year. $1 a month, excuse me. $1 a year is too cheap. $1 a month. And that we would pick up the tab for the utilities and whatnot. And I think the incentive, it's obvious, and that is to get more people moving to this area of the city, recognize the opportunities that exist here, and then eventually make a decision, hopefully, to be able to expand their operations here. So Whole Foods is one of our first, and we're delighted. And I want to thank you, Scott, for being here with us today, and we'd love to hear from you.
Those fish were swimming a day or two ago in the ocean, so I think the mayor feels them looking at them. Yeah, so, yeah, we're happy to be a part of it. I can tell you that we've been a part of the district for 2 decades, and I moved to the area. Actually, live just outside the district. Sorry, but I came to run the region a couple of years ago, and one of the things I said when I came to the region is we are going to deepen our commitment to the city and the district. We have hundreds of team members that live in the district, and they're excited every time I say we're going to open another store in the district. They get excited, and the community gets excited, and of course we do too. So broadening that commitment is something we're going to do. We have 7, 8 core values now. 2 of the core values are, our commitment to our global and local communities, right? And the other one is providing health education to our stakeholders. And one of the things, is like hospitals are important too, but I think everybody inherently knows that health starts here with what you put in your body. So we're out to help change the education around that. And so we have a couple of our healthy eating specialists. We have our associate coordinator for healthy eating here in the region, Kathleen. We got Chris, who's one of our specialists, and many more like them that are in our stores are going to be here on those Saturdays that we're going to play along to help show people how what you eat can change your health outcome. In addition, we are going to offer, of course, fresh foods, vegetables, fruits. You can see up here, this is a sampling of what we'll bring. So, and the guy heading it all up is Joey Herndon, our executive coordinator. He's going to be here and make sure that everything's going smoothly. So that's great. I appreciate the opportunity to speak because I think it's important for everyone to know. I think last time, actually, I did this, Mayor, I was pitching you about Walter Reed, so I'll say it again. That's another, I know you don't control it, but that's another area we would love to have a store in. So anyway, it's all about improving healthier access to food for all. And that's what we're a purpose-driven company. We're a mission-driven company. And we are going to change what people think about Whole Foods Market's commitment to that mission by doing things like this, by trying to stretch ourselves a little deeper and further into the communities and really make a difference in health outcomes. So that's our goal here. We're happy. I came, and this facility is so cool. We said, I don't care what's going on there. We just want to be a part of this facility. And then I met Catherine Buell the day we came out here, and I said, she's so infectious that I was like, I don't care, whatever you say, Catherine. Yeah. I was just like, it's going to work no matter what. So hey, it's just a natural extension of what we do. And I just want to take this opportunity to invite everyone to come out on the 5th and be a part of it, support it, be a part of it, and help change what's going on. So.
First of all, fresh food needs to be bought weekly or every 10 days or so. What good is a once-a-month market for people who need to buy fresh foods on a regular basis? Once a month seems like not often enough. Why not weekly or every 2 weeks?
Well, we didn't develop the schedule. We're participating in it. So the mayor could answer.
Well, the current schedule is once every never.
Well, Mr. Mayor, that's a cute answer, Mr. Mayor, that's a cute answer. But if you want people to buy fresh foods, they have to be available when they need them, not on a monthly plan. I don't understand the monthly aspect of this. Either you're in or you're out.
Tom, it's a beginning, okay? We don't have much of any of that over here at this stage. We're trying to get people accustomed to being able to have these kinds of amenities available to them. Our plan is not to have it once a month, forever. It's to be able to get people accustomed, and frankly, they're retailers. They're in this to make money. And if they see the profit motive being fulfilled in this, I think that Whole Foods will come. Obviously, he just made that shameless plug for Walter Reed, which is okay. And I'm looking forward to him doing the same thing for this area of the city.
I do want to, just real quick, I do want to say one thing about the profits that I failed to mention, which I should have. And that is, because it's once a month, because it's an experiment, a test, right? That's what this is. This is a test for us, and we are treating it as such. But we're also here to support the community as well. So we talked amongst the leaders, and we said, this would be a good step for us to, again, solidify our commitment by we're going to take the profits that we would make. So we're going to sell these items at what we sell the prices for in the store. And you all, when the mayor said affordable prices, you all get excited. You don't. I think there's a misconception out there about Whole Foods. We have a wide range of choices, and these beans are 89 cents a can every day at Whole Foods, any store you walk into. So, yeah, we're going to round it off because we don't have a cash register. So, those fruits will probably be 75 cents each. The kale will probably be $2.50. We were talking about the prices last night. But the big thing is all the profits we get, we're going to donate to not-for-profit organizations that are in this district and in this ward. And yeah, and the people shopping, the people who are supporting the market will get to decide which nonprofits it goes to. So we're not going to decide. The people are going to decide where they want their money to go that they're spending here. So I think that's just, again, another little add-on that we do that in our current stores. We don't donate all our profits, but we donate. We have to grow. We have to grow. But we donate a good portion to a lot of things, and it's part of who we are, giving back. So I just want to make sure I raise that point.
What's in it?
Yeah, that's the other thing, that the people are going to decide. We pick what items we think are best. Like, we don't have potatoes up here. We think russet potatoes would be good. We're thinking things that people buy often, but we're also going to lean, as the theme is, towards the health side of it for a while. So fresh fruits and vegetables. We all know if we ate more fresh fruits and vegetables and exercised more, we'd probably raise our health outcomes a little bit. And so I think that's what we want to offer first. Then, of course, fresh fish and some meats. We got to meet people where they are. And so there's items here that we think people will like that they buy the most. Soup is really good, so healthy soups. What's that? See, we're taking requests right now. So if you're going to shop at the market, make a list, bring it to us, and we'll bring it back the next week. A pop-up market picks the top items, top-selling items we think people most. The other thing we want to do is we want to complement the other folks who are here. So if Arcadia's coming with a food truck and they're going to have some items on it, we don't want to compete. We want to complement. So we're flexible enough. We have so many items in our stores that if Mom, Pa, Gardner wants to bring their product here and sell it, and they're bringing product, we're not going to compete with them by selling products against them. More than likely, we would sell it cheaper. Hard for you to believe, but we would sell it cheaper than they would at a market. So we don't want to compete. So it's whatever will complement the market. We're going to learn. We told Catherine we're going to work on this together with her and figure out what works best. We can keep expanding it or contracting it to whatever complements, because that's what we're here to do, is complement it, not run it. So, yeah.
Thank you, Scott. In all seriousness, I want to thank Whole Foods for doing this. And, presumably everybody recognizes the nexus between the first announcement and this one. And it is about promoting health and wellness rather than promoting responses to sickness. This is a response to sickness. It's called prevention. And there hasn't been nearly enough of that on this side of the city. And that's exactly what we're bringing. We're bringing a hospital, obviously, to be able to respond to people when inevitably they get sick, a quality product in that regard. But we're also bringing an integrated healthcare system that will give people a chance to be able to not get to that point. People have focused a lot on having health care coverage, but it's important, but it is a minor issue by comparison to the larger issue, and that is, what do you do with the health care coverage once you have it? There's still far too many people who have quality health care coverage, and they only use them when they get sick. That's why, as this health care system expands in this nation, we've got to have people, you can call them navigators, you can call them case managers, you can call them what they want, but they've got to be focused on changing health care behavior, because the health care behavior in this nation right now, not just the District of Columbia, but this nation is very back-end focused. And it's very expensive, both in financial terms and in human terms, and that's one of the dynamics that we're trying to address at this stage. So the nexus between the hospital and an integrated healthcare system and having these kinds of opportunities available to people, hopefully it's obvious. Yes?
With Congress Heights, in the press release you referenced building up around Congress Heights Metro Station. What plans besides, I know we have the new hospital proposal, any other plans you have to develop? What do you mean by that?
What?
By redeveloping around the Congress Heights Metro Station. It was just mentioned in the press.
Oh, well, the St. Elizabeth's, Catherine, you want to come up? Those are huge plans that we have. We have 180 plus acres of land here. For example, the innovation centers that will be coming here, Sidlam, SmartBIM, Microsoft, all will be a technology presence here that will create jobs and opportunities that don't exist. So the hospital is really just a part of it. There's going to be offices built over here. There will be housing that will be built. It will be, kind of a brand new community that's being developed on the east side of the St. Elizabeth's campus.
Does that include the Anacostia Association, like both sides? Like, will it include the whole area?
Well, in this instance, we're talking about St. Elizabeth's, but the St. E's property goes all the way down almost to where Berry Farm is, down to where Matthews Memorial is. And, of course, it goes north to Alabama Avenue, so it is an extensive tract of land. And obviously, we hope to be able to take advantage of the catalytic opportunities created by Homeland Security, and specifically the Coast Guard being across the street. The Coast Guard has 3,700 employees in its new headquarters over there. We suspect that as time wears on, there will be people who will choose to live on this side of the river, on this side of the city as well, and we'll bring a different and expanded presence here. So we're looking way down the road. This is a multi-year effort. There's a lot of work that's already been done. I want to thank Deputy Mayor Hoskins and his staff for the great work that they've done to help us begin to realize this vision. I'll tell you what it does also. It gives new hope to the people who really have had lots of reasons not to be hopeful about what's going on completely in the city. There are folks who have, speculated, often wrongly, about what I mean by one city. One city is not everybody getting along with one another. That's just mindless. What it means is that irrespective of where you live, geography should not define your future. That geography should be a complement and a support to what your current situation is and what your future is. This has been a largely neglected area of the city, and that's what we've been trying to work on for the last 3 years and 3 months, and that is bring a new sense of hope, a new presence to this end of the city. This is an incredible area here. And for those of you who've never done it, you ought to go see some of the vistas. You ought to go up to the panorama room. You ought to go to the Point at St. Elizabeth's and look at some of the vistas in this city. They're some of the most breathtaking scenes and views imaginable and, in fact, available into the District of Columbia. Pardon? Douglas House, that's exactly right. This is a phenomenal area of the city that unfortunately has been defined by social pathology and has been neglected as a result of that. And that's what we're trying to change. And I think this is going to be successful. Well, wait a minute, Tom. Let me have Catherine say something.
Well, I don't have much to add to that. We have 5 million square feet of mixed-use development that the hospital will be a part of, but it includes residential, retail, office, and housing. We'll also be releasing our Phase 1 master development RFP momentarily. So that will kick off and really speed up the redevelopment of this entire campus.
Subjects now, please, sir.
Well, there are people who came only for these two announcements, so I want to give them a chance to take their leave if they wish. That's very kind of you, Tom. I appreciate that. And if you'd like to apply to be my scheduler, I'll be happy to consider you. But before we do that,
I see the private.
those who would like to leave, you are free to do so because we're moving on to other stuff at this stage. So if you would do so now, we'd be delighted. Sir?
Deputy Mayor Quanders here, it might be appropriate for him. There are some suggestions and questions about the timeline. Can we know when was the last time DC employees saw the child? Was Child and Family Services actively working with the family? Was the Amber Alert properly conveyed to Maryland and Virginia? We're told that all these are major serious questions, that these things did not happen.
Yeah, let me ask Deputy Mayor Quander. I actually did, and I'll just make this brief statement, Tom. I read a chronology of interaction with the family by DCPS, by MPD, and by Child and Family Services, and it's pretty extensive. Paul, I'm sure, knows a lot more about it, or BB knows a lot more about it than I do. And if you want to come up, Deputy Mayor Otero, you can join in this. But from what I read, Tom, it's a pretty extensive level of interaction that's going on. But I'll ask the two of them to add to that.
Was the Amber Alert properly conveyed to Maryland and Virginia? We've been told that there was information sent to Maryland and Virginia but didn't go to the right place.
There's a process that we follow in the National Capital Region, which includes Maryland, Virginia, and a number of the local counties. And that process is that when you have an Amber Alert, you notify the Emergency Management Office for each of those jurisdictions. And that was done. On 3/20, at 12/22, at 4/46, and at 10/13 on March 20th, both the Maryland Joint Operations Center and the Virginia Emergency Operations Center were notified. They were notified of the event, and then those subsequent notifications were the updates as things changed. The same thing took place on Saturday, I think March 22nd. There was a notification that went out because we had some additional information that we wanted to get out to the community. So what we are doing now is going back and contacting each of those jurisdictions. They did receive it. We verified that. But one of the things that we're working with each jurisdiction is now, once you receive it, what are your internal procedures to make sure that it gets to the right authorities within your jurisdiction? So,
Delayed alert.
I'm not sure when they acted upon it, but our responsibility is to make sure we get it to the right location within the state that has been designated by the state, and we did that. We not only notified the individual states, but there are a number of jurisdictions within the state. So Prince George's County, Montgomery County, Manassas, all of the other locations, Fairfax, Arlington, received the same notification. So we didn't just rely upon the states. We relied upon our partners and the other jurisdictions, the local jurisdictions as well.
And you don't control what they do. Right?
That is correct.
Are you concerned about the fact that as of yesterday, both Maryland and Virginia said that they had no active Amber Alert for this little girl?
Well, we know that there were Amber Alerts and notices that were on 270, at least on Thursday evening and Friday. We know that there were some notices that were on I-95 in Virginia. I think it's an eternal issue that the states are going to have to look at and work. We're going to use this as a learning opportunity for everyone in the region. But the responsibility that the district had was to get that notice out, to get it out promptly, and that's what we did. We did it, and we have the documentation to indicate that we sent it out, that it was received.
Mr. Quander, you just said that on Saturday you had additional information, but I was watching this very closely, and I was following it on MPD's Twitter feed, and the chief said, Monday, I guess, that they had issued this Amber Alert again on Saturday, but I noticed that there was no reference there at all to this Mr. Tatum. There was no photo of Mr. Tatum. We already knew that the pickup truck had been found. But you said that there was additional information issued on Saturday, but I didn't see that. Can you tell me what that is?
I certainly will. It says, update. The Metropolitan Police Department is seeking the public's assistance in locating Relisha Rudd. She is described as an 8-year-old female, medium complexion, 4 feet in height, and 70 to 80 pounds. She may be in need of medication. She may be traveling with Khalil Malik Tatum, also known as Call Malik Tatum. He is described as a black male, height 5'9", weight 200 pounds. He should be considered armed and dangerous. And it's sent March 22nd, 15:32 hours. So again, we're sending the notice out. We're asking for the public's assistance, and we are still asking for the public's assistance. Job one is to locate this little girl and bring her back. That's where the focus is, and that's where we need to concentrate. But I wanted to answer your question to make sure that the public knows that we did, in fact, send the notice out. It got to the right place. And so now we need to work with the states to make sure that once they receive that notice, then it, through their internal system, it gets to the right place.
Wait. Is it on the same issue?
Yes, the same issue. And what I'm saying is if you go on Maryland's website right now, Maryland State Police, or if you type Amber Alert Maryland, you get the state police, and it says no active Amber Alerts. So what I'm saying is this has been reported. Why hasn't somebody called the state police of Maryland and said, how do we get this on your site? I mean, it would seem that would be simple.
We have done that. As I said, we have gone back and we have verified that they have received it. We have talked to them about whether or not internally they have posted it. I have told you that I know that on Interstate 270, there was a bulletin posted that we saw. So someone has posted it, either from the Virginia Department of Transportation or others within the state, in the Maryland system. So we know that it got out, that it has been posted. It is a Maryland internal issue. The other facts of this case that we all have to remember is that this was not your normal Amber Alert type of a factual scenario. This is a case in which a mother gave authority to an individual to have custody of her child, and that in the initial stages there was no crime. There was no crime. So when this first developed, when we tried to get search warrants and things of that nature, we had to establish that a crime was committed, but there was none. And so as a result, this takes it out of the normal context for which you would normally have an Amber Alert. We only were able to issue the Amber Alert once the events in Prince George's County surfaced and it was discovered that we had a homicide victim. And that's when we were able to do some of the things that we need to do to notify people and to get the Amber Alert out.
So, Mr. Quandra, is this still?
Let me do this. Hold on one second. Tom, and then Mike.
The Deputy Mayor for Human Services might want to answer this. When was is Child and Family involved here? When was the last time Child and Family DC employees ever saw this child? There was an active case, as I understand.
Yes, there was an active open case with Family Services. I don't have as the mayor said, I read the same sequence of events as he has. What I do want to say is that there's been a real intense collaboration among city agencies, which is something that was a concern in the past, that different agencies touched somebody and they weren't communicating and connecting with each other. What is really evident today, what's changed in our practice is really that collaboration, in this case, CFSA and DCPS and DHS and the individuals that run the shelter. When I went back and looked, the caseworker at CFSA had met with the family and attempted multiple meetings with the family at the shelter, at the school, and if I'm not mistaken, I'll go back and I'm happy to come back and tell you exact dates. I think it was the 26th of February when the caseworker from Family Services last saw the family at the shelter. But we also know that the teachers, one of the teachers at school saw the child on the 5th of March. So we do have a sequence of the child having been seen. And what I want to highlight is.
February when the caseworker last saw the child? It was February.
I believe it was February 26th, but let me double check. I don't want to give you the wrong information, but I think the other is that is I think as Deputy Mayor Quandra said, this is an unusual case. This isn't the parent didn't file a missing child report. This was the various workers within DHS and the school system who became concerned. And it was their call that alerted all of us to the situation. So I feel very confident that the work that was done across our systems, and this has been the work we've been doing for the last 3 years, is to look at how to make sure that we are connecting across the various systems that touch some of these very families with lots of needs and very troubled.
Mr. Mayor, can I put that question to you? Are you confident at this point that everybody in the DCPS, and CFSA, and the police department did what they were supposed to do in this case?
As much as I can evaluate it at this stage, Mike, the answer is yes. I read an extensive chronology, and obviously, for obvious reasons, I can't go into the details about what the chronology said, but it chronicled a very extensive level of involvement over an extended period of time. So, yes, I am. Again, we're going to learn more about the mom and the mom's activity in this as this continues to unfold. So, I guess to your question, and that is whether I feel that agencies were engaged in the way they should have been, as best I can evaluate it at this stage, the answer is yes.
Do we have any?
The mother in her role in this, and I believe you gave an interview where you sort of suggested that if a mother isn't taking care of her child, there's only so much you can do. Can you sort of elaborate on that? What do you mean by that?
Well, there was, to my knowledge, there wasn't sufficient evidence to have an allegation of abuse or neglect, which are the criteria that are used to have CFSA step in and remove a child from the custody of the mother. Again, not to get into a lot of details, Mike, because I think that would be inappropriate, but I certainly did read a chronology where the DCPS folks were involved with the mother, trying to find out why the child hadn't been to school, and they were told that the child was sick. There was nothing that I read. Now, there may be more information that will be revealed as we go forward, because I don't purport to know everything about this. But from what I've read, it appears to me that the agencies involved took responsible action.
Do we have any update at all? Are police any closer to finding Relisha? Do we have any idea where Tatum and Relisha might be?
I'm going to leave that to Chief Lanier to speak on. They are actively continuing their investigation. They are pursuing a number of leads. As you know, the FBI is involved and is participating and assisting greatly. But any other comments I'm going to reserve.
Paul, as you can tell from all these questions, some of us reporters are quite troubled at how MPD's been handling this. We didn't even hear from the chief until 5 days after they had put out a critical missing persons. This girl is 8 years old. There was no daily news conference. There was no updates. It was incredibly difficult to get any information out of MPD. They didn't even put a photograph out of Mr. Tatum. You look at other Amber Alerts and you see photographs side by side of the person they're supposed to be with. None of that was done. Do you have any? Are you troubled at all at the way MPD has handled this?
No, I'm not troubled, and I do not accept the premise that you laid out. There were photographs that were provided of Mr. Tatum. Remember, as I said initially, there was no crime. There was no crime that was reported. There was no missing person filed until workers from government agencies got involved, started asking questions, and when answers didn't jive, when facts just didn't seem to make sense, then those workers took it to the next level. But again, as I said, when we started to look into it and we started asking for search warrants and things of that nature, we could not meet the standard of proof because we did not have a crime. So we could not, let me finish. So you go through that process and you try to develop and you work within the framework that you have. Once we established that there had been a crime committed, and once we were able to establish that Mr. Tatum was a person of interest in Prince George's County, then that gave us the predicate that we needed to move to the next level. So that's when we issued the Amber Alert. That's when we put the information out. When the chief, we put new information out when we had additional photographs of Mr. Tatum showing a tattoo, because we're trying to get as much publicity. We want the community to help us in locating and reuniting Relisha back to her family, back to our community. So that's the process. I know the chief and the men and women and the recruits and every resource that she has available are working. They were working late last night. And they're doing things to make sure that we do this methodically, that we can document exactly what we're doing so that we'll be able to cover every area that we need to ensure that we have left no stone unturned. So they're working diligently. I get regular updates. We probe. I keep the mayor involved. Yes, I'm satisfied with Metropolitan Police Department and the role that they're playing, and I have faith that they're going to continue to do what needs to be done until we can bring this matter to hopefully a successful conclusion. And this is the last question. Please.
Okay. Another issue is there was a video that came out, and the chief had said they're doing everything they can. They want as much publicity as you can. You just said they wanted as much publicity. But this video surfaces on another television station, and then we're asking for it, and they don't want to release it. And then when they do release it, it comes out after the evening newscast.
Exactly.
It doesn't seem to make
From
any
the
sense.
FBI.
I don't know what the particulars are about when that feed was provided. I would venture to say that the chief, who has the lead for investigating this, thought that it was probably best to withhold certain information until we could verify it, until we can get every evidentiary lead possible from it. Sometimes you don't want to provide all the information that you have because you want to track down, you want to verify, you want to talk to witnesses, you want to talk to personnel who may be at that hotel. And so oftentimes we have to balance that with the need to achieve our ultimate goal, which is to locate this little girl and bring her home. And if sometimes that means that the media doesn't get it as soon as it needs to get it or wants to get it, then that's what we have to balance. Thank you very much. I appreciate your time.
One more question for Vivi.
That was it. Mike, grab her after we're gonna stop now. Thank you all very much.